how much of a setback is this for J&J, and how much of a setback is it for emerging markets that we're kind of at the front line to receiving the J&J because it's cheaper and it's a one-shot vaccine?
In the United States, the J&J vaccine has sort of lagged because it's been plagued with issues. For example, an 11-day pause after a rare blood clotting disorder was associated with it, a lot of bad headlines about their manufacturing. So it's never been a major component in the U.S. But I do think that this is going to add to vaccine hesitancy in the U.S. with specific to the J&J vaccine. And I think it's unfortunate because when you look at the risk-benefit ratio, this vaccine is still highly favored. And I think it will still be something very important for emerging markets because its advantages, the fact that it's one shot, the fact that it doesn't require extreme cold storage still makes it a very attractive vaccine. And I think what we have to do is really teach people about how to make risk-benefit calculations. And we're talking about 100 cases and over 21 million doses given. This is a very rare type of thing. And I think it's important that people be aware of it. And it's definitely important for clinicians to be on the lookout for this rare side effect when it does occur. But we've seen Guillain-Barré syndrome occur with other vaccines. Guillain-Barré vaccine occurs after Guillain-Barré syndrome occurs after certain infections. So this is something we anticipated. And it really shows that our safety monitoring systems are picking up these very rare side effects. So people should be reassured. And I think people should still get the Johnson & Johnson vaccine.
Dr. Adalja, speaking of vaccines, I'm wondering if either those who've gotten a Johnson & Johnson or a two-shot mRNA are going to have to get one, a third or a second relatively soon. We heard Israel yesterday offering a third COVID-19 shot to those with weak immune systems. Are we going to see that in the near future in other countries?
For individuals that are immunosuppressed, I think we're still waiting for some of those studies. We know that they don't react as well to the standard dosing regimen of the vaccines, and there are efforts underway to understand whether a third dose or an additional dose might boost their immunity. But what we want to do is really look at the actual clinical data. Are people who get the normal dosing, are they getting breakthrough infections at a higher rate? And are they getting breakthrough infections that are clinically significant, meaning landing them in the hospital? That, to me, is the threshold for a booster vaccine. And while Israel might be doing something and Pfizer might be saying something, I think we have to continue to look for clinical data to actually support the use of a third dose. And to me, I think in the near term, that's not likely to be the case, especially for the general public. And I think we can argue about immunosuppressed populations, whether or not that third dose is justified. But in general, what we're seeing is these vaccines are very durable, especially when it comes to what matters, serious disease, hospitalization, and death. So to me, I think that booster talk is really premature. It's important to study boosters, to have a pathway for quick approval, but I don't think we're ready to pull the trigger yet.
So, Dr. Adalja, if vaccines are one side of the story, of course, social distancing, behavioral factors are the other side. Here where I am in the UK, you have restrictions starting to ease come the 19th. And at the same time, they're warning of a spike, a potential spike when that happens in COVID cases. In areas like the UK where you have a Delta outbreak, is it too soon to be taking our eye off the ball here in terms of social distancing and other restrictions?
What you have to remember is that the whole reason that COVID-19 became a public health emergency was not because of the cases, but because of its ability to threaten hospitals. And in the UK, what we've already seen, even with a lot of Delta variant, is a separation, a decoupling between cases and hospitalizations and deaths. So I think we have to remember that COVID-19 is not going to be something that's eliminated or eradicated. It can't be driven to zero. What we're trying to do is remove its ability to threaten hospitals. So long as your high-risk population or enough of your high-risk population is vaccinated, you're going to see cases, but not hospitalizations. And I think that's sort of what we're trying to do, is tame this virus, make it more like other respiratory viruses that we deal with year in and year out. And that may be the path that the UK is on, that you'll see cases, but the hospitals will be okay. And I think it's important to increase vaccination rates and to tell people who are unvaccinated that it's important to still be vigilant, wearing a mask in indoor settings, trying to social distance and trying to stay away from crowded congregated places, but most importantly, to get vaccinated. But I think it's going to be a case where many countries will have cases, but they won't have hospitals in crisis once they get enough of their high-risk population vaccinated. And that decoupling, that's what we have to do.
Yeah, in France, not enough people are getting vaccinated. So we actually heard from the president saying he's going to introduce a kind of green passport, or, you know, a green thing that basically, not green, but vaccination passport, so that when you go to a restaurant, you have to show that you've been vaccinated. Is that the right thing to do for in countries where actually people are afraid of getting vaccinated?
I do think it's very important that people who are fully vaccinated be treated differently, because when you're fully vaccinated, the vaccine treats you different. You're no longer a threat to others, and others are no longer a threat to you. So if private businesses want to use some kind of mechanism to cater to the vaccinated only crowd, I think that's really important. And it also provides an incentive for people to get fully vaccinated because they can see that this vaccine is something that's of personal value to them. It allows them to reclaim their pre-pandemic life, and it's going to protect them from COVID-19. And for too long, I think we undersold the vaccine and didn't really tell people that this is your ticket to normalcy. And I think that when vaccinated people are able to go back to their normal lives, that's an incentive for unvaccinated people to say that they want that to be their life too.